Hey everyone, my name is Marisengo. I'm a student at Southern New Hampshire University. I'm working on healthcare management in global perspectives concentration. Now I'm working on the goal which is called utilize healthcare data on the second project which is called electronic health records. So in this project, I want to begin with the introduction or the definition of the meaning of electronic health record. As definition, electronic health record is an online technology used by healthcare providers while recording and keeping patients' information instead of using paper charts. It's used while providing medical care to patients and also assessing a medical practices daily operations. Let's move on the functions of electronic health record. First, uh, the first function is to identify and maintain a single patient record for each patient. Second, it captures and maintains demographic information. Where appropriate, the data should be clinically relevant and reportable and trackable over time. Another function, it creates and maintains patient-specific problems list. It creates and maintains patient-specific medication list. And lastly, it captures and tracks orders based on inputs from specific care providers. So now let's move on the two components of electronic health records that support clinical care. So the first component is prescription medications and ordering lab tests. Uh, the importance of electronic health records in this component, it helps to submit prescriptions electronically and the system will alert provider if the prescription could trigger an allergic reaction or an adverse drug event. Second, the patient cannot lose their prescription. Third, it enables efficient refill multiple medications. And lastly, it order diagnosis and laboratory tests directly from the computer. The second component is remote access. Electronic health record help to access patients' records securely from outside the office. This means in case of an emergency or if a patient contacts you with a question, you can access the record from home and respond to the situation equipped with all information you need. Second, the electronic health record helps to finish working at home without transportation a stack of charts from the office. Now, let's look at the issues associated by electronic health record under clinical care. The first issue is privacy and security concerns. This issue means clinical providers tend to use patients' information without their permission. In this sense, it means they are violating HIPAA law. Second issue is lack of technology. Some providers do not have experience in using electronic health record while recording patients' information, and as consequently, this will cause providers to make medical errors, which leads also to drug adverse events. Another issue is the financial issue. Since the implementation of electronic health record requires high cost, some clinical fail to afford money to use during the implementation. Another issue is that patients' information is disclosed by electronic health record vendors to redesign the nation's health care. Now let's move on the two components of electronic health record that support administrative process. The first component is management. In these components, electronic health records helps to assign tasks electronically and monitor the time it takes for them to be completed. Second, electronic health record tracks patient waiting times automatically and identify bottlenecks in the practice. Lastly, electronic health record reviews staff productivity by examining healthcare provider and staff output. The second component is privacy and security. Uh, elec- uh, Electronic health record helps to capture privacy notices and consent forms and attach them to the patient records. This reduces storage and ensure that these important forms are easy to review. Second, electronic health record updates and maintains the access rule for each staff member. Electronic health record allows customizable role-based access, which allows you to select parts of the record that each of your staff can use. The issue connected with electronic health record in this component, the electronic health records products are expensive and require a major investment. Second, the electronic health records application are not identical. Third, electronic health records are more difficult to use than paper-based records. Fourth, the electronic health records implementation reduces practices productivity and disturbs workflow. Lastly, the electronic health record benefits accrue to others, such as society and payers, not to providers. So now I'm going to talk about the advantages or benefits of electronic health record in general. First of all, those benefits include the ones from the ones of health providers and the same times as the hospital. First of all, electronic health records helps providers to keep patients' information in confidential way. Second, it helps patients to access their health records once they need them. Third, it helps providers to share information to patients and other clinicians. And also it helps providers to do not commit medical errors result from wrong records. Also, it helps patients to receive effective diagnosis. It enables trustful prescription, and lastly, it improves patient and providers interaction and communication as well as healthcare convenience. Lastly, it reduces costs through decreasing paperwork, improves safety, reduce duplication of testing, and improves health. So, like conclusion, I would like to conclude by saying that electronic health records it's something good since it helps providers to record well patient information as well as the medications which related to their illness. Uh, the advantages of this is that once a provider or if a patient receives a medication which is related to his or her illness, it cures the illness that he has. Secondly, it helps the hospital to keep the information of patient where they refer to those information while making the decision. For instance, they can focus on the previous data of patient. Maybe they can find that the previous data there were a high number of people were suffering malaria. So in that case, they will acknowledge the problem they faced and they found how they can avoid it to happen again. So this is the end of this presentation and thank you.